In today's competitive medical device marketplace, successful integration of reliable, ready-to-use connectivity solutions can make a critical difference. The Affinity Medical Technologies Molex 4-inch PRE-CRIMP A2016 Blue, part number 0039000219-04, L2D, offers a turnkey answer for manufacturers seeking robust and efficient wiring assemblies for their products. Imagine a medical device assembly shop in a mid-sized OEM facility. Time is of the essence, and consistent quality is non-negotiable. The production manager, Taylor, evaluates components for the next-generation infusion pump. One of her primary requirements: dependable pre-terminated wires that guarantee connectivity uniformity, minimize operator touch times, and significantly reduce the margin for error. Taylor settles on the Molex 4-inch PRE-CRIMP A2016 Blue 0039000219-04, L2D after conducting a supplier comparison.
Why?
Every wire in the shipment arrives cut precisely to 4 inches, with the termination expertly crimped to specified A2016 receptacle standards. The blue color quickly distinguishes it as a signal wire, supporting fast identification in a crowded connector array. Consistency in color coding minimizes cross-wiring errors during assembly and calibrates seamlessly with both manual and automated harness production lines. Supply chain reliability is another reason Taylor trusts the Molex solution. Affinity Medical Technologies' alignment with Molex assures traceability, complete documentation, and compliance with international medical standards. A single batch can be tracked from raw material sourcing to the finished wire assembly delivered at the dock. Besides efficiency, safety is paramount. The terminals on the pre-crimped A2016 wires are engineered to create secure connections that withstand vibration and flex, minimizing failure risks common in critical care devices. The smooth, automated crimping ensures every contact meets exact tolerances, and the blue insulation offers improved dielectric performance, meeting or exceeding stringent regulatory expectations. Taylor's decision triggers a chain reaction. Production lines run more efficiently and with fewer defects. Field service calls related to wiring issues drop measurably. In the quarterly review, her team presents a strong case for expanding the use of pre-crimped wires across additional product families. For medical device engineers and supply managers seeking reliability, efficiency, and safety, the Affinity Medical Technologies Molex 4-inch PRE-CRIMP A2016 Blue 0039000219-04, L2D represents a clear choice. Its robust design, color-coded convenience, and compliance pedigree accelerate time to market while reinforcing quality in life-critical devices.